So, if you feel that you get infected with the coronavirus, should you self-isolate at home to not infect others? Should you continue with your life as usual so you can have a job and feed your family? Should you go to the hospital and to look for treatment? To answer this question, we have here today a good friend of mine, Patricio Tamariz, Patricio in English, probably Patricio Tamariz. He currently lives in Guayaquil, Ecuador, one of the most affected cities, perhaps the most affected city in the world by the coronavirus. Patricio is a former Vice Minister of Tourism for the country of Ecuador. He's an expert surfer. He started, let me see, to say it correctly, he's the first vice president of the Surfing Association of Ecuador. He has taught presidents how to surf. Patricio, it's a pleasure to have you here with us today.
Thank you, Will, and it's a pleasure to be here. It's a pleasure to talk about my experience, because if it helps somebody, it's worth it. And I think what you've said, about self-isolation, it's something, first of all, this is such a thing that we've never ever lived, right? I'm sure you've heard it by everybody, but it's something that I always say, this virus is a virus which has a machine in it that replicates very well, but doesn't have a brain. We have the brain, and collectively we can outdo this, I'm sure, and be prepared for other versions of virus or anything else that could happen. And it's interesting that at the end of all this, hope is the most important emblematic feeling that you have because of this.
Patricio, let me introduce our viewers to my co-host and almost friend and co-founder at cure.home.org, a famous engineer, Nathaniel Miller. Hi, Nathaniel.
Hey, it's good to be here, Will. Patricio, it's a pleasure to be on.
Hola, Nathaniel. Hola.
So I'll in 15 seconds, I'll tell our viewers what you went through. You were infected with the coronavirus, Patricio. And so yes. Around March 15th, you thought that you had the coronavirus. 5 days later, you went to the hospital for testing. You decided that you didn't want to stay at the hospital. You went back home. You self-isolated yourself for a total of 36 days. Starting from the 15th with that minimum interruption of visiting the hospital one morning. You stayed in your bedroom, but the rest of your family was at home. And they were like feeding you from pizzas underneath the door or something. And you always had a mild case. It never became extremely severe, but you had a few days where you felt shortness of breath and chest pain, I believe. Correct me if I'm wrong. And then 36 days later, you opened the bedroom door and you said, "Here I am." And we are very happy to count you among those who survived.
Thank you, Will, so much. And the first thing I did was to have the first conversation and hug with my wife, So that was important. And I tell you, I don't know if Guayaquil, for example, is one of the hardest hit areas of South America. And Guayaquil is a beautiful city. It has great people. It's super tropical. It's like the New Orleans of South America. It's right on a beautiful river. And there's beautiful an antique old colonial Spanish sector, and there's a lot of people who believe in the city and are very proud of the city. And what happened to us was that we were unprepared totally for this. We had a situation where we had the first registered person coming in from Spain that had COVID was on the 15th of February, right? But I've been talking with doctors of high-level doctors here in Guayaquil, and they're saying they had people that had been losing a sense of taste and smell days before that. And why is this? Well, they're saying that there was these flights coming in from China all the way to after the Chinese New Year. They were coming in to Italy, and Italy basically has a large population of Ecuadorians. Spain also has, and you could tell that the connection of Europe and all the airlines in Amsterdam. If you go by KLM, I have friends that say that they were filled with Chinese. And so all of a sudden, I'm not blaming the Chinese on this, please make sure I'm saying this, but it was the quantity of people coming in from our vacations, like your vacations in the United States are in the summer, our vacations are in the winter. So everybody was out in Europe, and all of a sudden this hits and everybody comes back into the city, and all this, and they're coming in from Italy, from Spain. And so all of a sudden, nobody thought of this, right? And they're going to big weddings, hundreds of people attending, which some of them got infected and also have died. And we had soccer games, 30,000 people in a soccer game. So I think, when we did close, the president on the 16th of March made the lockdown, it was an important move. But because we weren't prepared for this, maybe we'll be prepared for this in the next 100 years.
Patricio, so you thought that you had the coronavirus on March 15th. You self-isolated yourself from your family in one of the bedrooms. But then on the morning of March 20th, you decided that you needed to go to the hospital for tests.
Right.
What happened that morning in the hospital?
Well, what happened was that I had been feeling symptoms, and all of a sudden I had my chest was hurting, and I woke up without being able to breathe, and I was going, oh my God, you got to go to the hospital, and against the will of my family, because my family was saying, no, don't go, because it's, if you go, you break the quarantine, right? And you have to retick the counter of the clock again. You have to start counting again. And I go, sorry, I got to go, because I'm feeling without breath. I don't feel enough oxygen. I can breathe, but I don't feel enough oxygen, and this is partially because my chest was hurting, something was happening, but also because of the mind. The mind plays something important here. You got to be, one of the things is you got to have faith, you got to be strong and with yourself and stuff. But that day I had to go. So I went to the hospital.
What happened when you arrived to the hospital?
Well, I went to emergency, right? And I went really early in the morning. And all of a sudden, as I'm there, I'm making, they're giving me the, blood tests and stuff. They didn't have the COVID exam. And that was the other thing that happened to Guayaquil. The delay of more than 2,000 to 3,000 people that were having the exams took 20 days for them to have the results. So everybody went back. They sent everybody back to their houses, and that infected everybody else. Because the thing is, this, you're going asymptomatic. Nobody knows that you have it, and this happens. So I'm at the hospital. I'm there and at the emergency room, and then all of a sudden, I just see people trickling in, coughing. But I mean, coughing really bad. And the doctor, asked me, well, do you want to stay? And I said, no. I got super scared with everything that was going on there, and I said, no, I'm going home. I'm going home right away. And I think the best thing that I
But
I
if you assume that you already had coronavirus, then you couldn't get it again. You already had it. So perhaps in the hospital you would receive better treatment because they have all the equipment than what you can have by yourself at home.
That's a good question. The thing is, I'm in the emergency room and I see a couple people without gloves, and I'm going, oh my God, this system, they're not prepared. They're not prepared for this. So I'm saying, no, I'm not going to risk. And that's what happens, you know. I mean, these guys are heroes. Most of them got sick. I had two doctor friends that died, you
Yep.
know,
Of
and
coronavirus.
of
And
Corona,
during the
12,
last
12 of my friends have passed away.
yep.
So it's something that you know, I feel for them, but I think that our health system wasn't ready for something like this. Nobody in the world's ready for something like this, because all of a sudden we had from on April from just having 45 regular deaths around March, mid of March, all the way up to the first 4th of April, that you had almost 700 deaths, you know, so per day. So it was just chaos. So you know, I'm being fed all this information. That's also bad. Just make sure that you get your sources right, where you get your information from. And you know, and I was, you know, I panicked in the hospital. I said, no, no, doctor, thank you very much. I'm going
Uh,
home.
well, not only in Ecuador, in several American cities, several Italian, Spanish cities, about 15% of all infected people are doctors and nurses. So one profession among hundreds totals about 15% of all infected people. And the only way to die is to first get infected. So we are managing to infect and possibly kill the one people that the only ones that can save us, right? So
Yeah, that's the most important. That's
that's
the
not
most
very
important
smart.
sector, because these people are, maybe I got mild symptoms because I got it on an airplane, right? Maybe just a low dose of the coronavirus. But these doctors are, you know, putting down the tubes for the respiration machines and everything. They're right there, and they get one dose here, one dose there, one dose there. And so a lot of them at the beginning didn't have all the protective equipment.
Nathaniel?
Patricio, I'm a scientist and an engineer, and I choose to not use my head. I choose to live my life from my heart. But I still have a powerful head. I liked what you said early in the conversation about you know, this is a virus, and it doesn't have a brain. It's going to reproduce and multiply fast, but it's a mechanism. It doesn't have a mind. We have a mind, and we need to think and be critical with our thoughts, and actually use our minds and use our head to understand and to do reasonable to take reasonable measures. I think in our structure, we kind of look across the landscape of all the different solutions, and we've categorized them around sort of stop the transmission, identify the infected, isolate the infection, treat in isolation, and learn. And in those last two, those are probably maybe the easiest two to do, but maybe the highest impact for the long run. You know, like you spoke as being in the Minister of Tourism, you know, the stopping the transmission, as you identified, is challenging. The identification, you pointed to the lack of testing available, and then the isolation of the infection. That's sort of where it comes to your story. I guess my question is around this idea of a home treatment kit. This is something that you have to think with, and then around this idea of the home treatment kit, you had anxiety, you had concern for your health, so you go to the hospital. Then you have concern for the hospital, so you go back home. Can you talk to the implications of the possibility of a home treatment kit that gives you the doctor remotely, that gives you the medication, the medicine or the care that you need, and then leaves you in the comfort of your own home, but addressing these anxieties? Can you speak around that a little bit?
Okay, I think it's the smartest thing. We have the technology to do that these days, and I think, you know, we do not have if we don't have information right there and there, correct information, or at least something approximate to correct information, because really this virus really surprised us all, right? But I know that there has been doctors handling very well this project through through virtual, and it's something new. But I think one of the things is if you don't have that help right away, and if you're not a strong person, I mean, luckily, I think I'm a strong person because I've been through a 7.1 Richter scale earthquake, 7.8 Richter scale earthquake. So I think I'm pretty resilient, and I think, I had, but I still faltered. I faltered. I had to, the anxiety and panic comes to you when you don't know what's going on. But luckily, I think that the thing is that if we have this kind of remote kind of help, it'll definitely help. There's no other way about it. And the best thing about it is that you're isolated. You're not making, you're not infecting other people. And this is going to happen again. So I think it's an important quest for humanity to look into help that is already there on the technological scale that we can definitely receive, and I guess that's one of the most important things that we should conquer. First is how to help ourselves in moments of crisis like this, and it's easy if we have connection with the world. If you're isolated and you don't have that connection with the world, it doesn't go right.
But Patricio, we think alike. And you mentioned resiliency and resiliency to communities, and you know a lot about this. I want to ask you about that and why I'm asking in 1 minute. Before I'll ask you for perhaps two very personal moments during those 36 days of self-isolation. And so one is, which one was the moment when you felt at the worst, that you think, oh, am I going to make it, or however you felt? That's one. Second, the rest of your family was next door, right? Just a hallway away, or a door away. Did you think, am I infecting my family, or who's going to take care of my family, or what happened?
Well, for your first question, the worst was the morning I woke up and I couldn't breathe. I thought, oh my gosh, I didn't know up to then that if I had COVID or not. And so I go, oh my gosh, I'm feeling all the slots of the symptoms that they're saying that COVID brings. So and in slang words, I think I freaked out. I got up and I went to the hospital, and that's the moment when you think, you're going to die. I mean, it's tough, and I care for many people with sicknesses around the world, and every night, every time I go to bed, maybe once in a while I turn on Netflix, and then all of a sudden I think, you're enjoying this while people are really going down in New York and Guayaquil and everywhere. It's terrible. You think about that, and you pray and try to get happy watching the news of people recovering and stuff like that. But the worst thing is to be alone, and I was alone in my room. But the problem was that my wife, a couple of days before, had been into a hospital. Her nephew was had an operation, and she got infected too.
Mm.
And she had fever, and she had 2 days of fever, and didn't get as bad as I did with with the respiration and stuff. But she's my hero. She was helping me while I was bad off, and my son also got it, and luckily my daughter, that when my son was going to come back from Germany, I told her, go to Bahia. She's, at least they're all good there, the grandmothers and everybody else. But the thing was that it was a tough situation for us, and we were alone, but I had contact with my cousins. One is a doctor. He's in Colorado, but had worked in Yale, Harvard, and Stanford. The other, a doctor that has been in the School of Medicine of the University of Miami, and works at the Veterans Hospital in Miami. And I had a doctor here, Dr. Rafael Caputi and Dr. Ricardo Marmo, that helped me go through this, at least through WhatsApp, at least that. But there was a lot of other questions I needed too to be answered then, but at least I had that support, and that made me strong.
Patricio, I assure you, I would never want to be in your shoes. And I congratulate you for now being on the other side of the door.
Thank you, and I thank God for that too, and my family.
Patricio, talking about resiliency and resilient communities, you invited me, I forgot, about 7 or 8 years ago to Ecuador, and particularly to your city, Bahia of Caracas. At that time, crazy us, we were thinking of building a green city, a self-sustained, off-the-grid city for international tourism. So Bahia of Caracas it's absolutely beautiful, and we were staying at your hotel. So about 4 years ago, you guys at Bahia of Caracas, you had a terrible earthquake.
Yes, it was one of the worst things that you ever experienced. It's a 7.8 Richter scale earthquake that devastated 2 provinces. And it was also felt all the way to Guayaquil and in other countries like in Colombia. And this was after a 98 earthquake that we had a 7.1 earthquake. And what happened then is that it's incredible. This is something that I think that nobody's written it in any handbook or in any scientific paper, where the resilience of people, how they adapt to catastrophes, that has been written for sure. But what happened was, it was incredible. All of Ecuador, Guayaquil, everybody the next day started to help us. I mean, it was incredible. Trucks and trucks and families and everything to try to help us. It was something that it came together. It was, oh my gosh, this is incredible. This is a solidarity between people you don't know, but are from the same nation. It was something that was really off the charts. It was great. And I thank all the Guayaquileños and all the Quiteños and everything for that. But that was during the earthquake. During COVID, you're isolated.
Yep.
That's a different thing. But finally, our family, we made an Eco Club Foundation, and we worked with the communities that are in the marginal neighborhoods. And these communities had no houses, and we helped them to make sure that the brilliance of family ethics and values could come back to them again, because the only thing they wanted to do was survive. But we've tried the best we could. Funds weren't enough and things, but I've made a beautiful project to help these families. The fathers, there's like 70%. There's no father figure in the families. There's almost 50% of adolescent pregnancies, and these are the neighborhoods that need to be fortified or strengthened in resilience. We need to have them have a feeling for life, or an objective in life. And that's one of the things after these catastrophes people don't have. And I think this is what all we need to do, and sometimes it's just one person that moves a whole machinery. Sometimes it's a lot of people, and I think this is something that all us humans have to do at the end of the day. Say, listen, I did something for other people, and not because of that to feel good, but that because you had to do it.
I've seen your work personally. What you do at Eco Bahia Foundation in Bahia de Caracas in Ecuador. And so if anyone viewing this interview, if they would like to donate, there will be a link for Patricio's Facebook page with the Eco Bahia Foundation.
Thank you
Nathaniel,
so much. It would mean a world for us if you helped us. Thank you so much.
yep, absolutely. Nathaniel, when we were right before we started the call, we were exchanging ideas, and you wanted to ask Patricio on air on his experience and what you are seeing about how the coronavirus is particularly impacting low-income communities.
Yeah, no, your comment, especially in areas of abuse and exploitation, is it has a surprising intersection with a common experience around coronavirus, which is that these atrocities happen in isolation. Your foundation, that's the thing that's so compelling, as I've worked with some of the communities in my area, with especially under like drug type oppression. The thing that's so striking about your foundation is that you're reaching, you've set up to you've connected this resilience to the connection, the individual connection in isolation. So if you can bring them out and connect them, that's really powerful, and just really touches my heart. I think that there's a lot to be learned there in terms of resilience. A lot of the follow-on effects of an economic downturn only exacerbate some of those isolating elements. I think it's to be interesting in terms of your experience with community resilience. Just to kind of talk about the impact. When we're looking at this, we're looking specifically in the medical care. You said a couple things that were interesting to me. One was it's to be alone, but I had contact, and then I had trusted help. Can you kind of take those three comments and connect them with this community resilience project, and put those in the context of coronavirus for us?
For sure. Like, okay, just my personal experience post earthquake, we had all these communities isolated. There was help at the beginning from all the nation, of all families and friends, and then all of a sudden we had the government come in and help after they got organized, because they weren't ready for it either. And the communities, when we went there with doctors, like my cousin Leonardo Tamariz came from Miami with his friends, and they came into the these camps, these tent camps, to help. When, I mean, it's good to have it be physically there, but we would have had something virtual that only they couldn't spend all their time there. But if we could have constant information given to these communities, it would have helped a lot. Um, Now, it's something that we have to see, that the poverty in most of these nations is because of lack of opportunities, sometimes bad governments, a lot of corruption, and I'm seeing that what we need to do is to have a governance system that has to work in the territory, and these governance systems in territories have to be public and private, and academic, community oriented, and to have a strong structure where we need to make sure that catastrophes like this or COVID, is going to be at least, uh, uh, the community will be able to adapt quickly
Yeah.
to you know
Yeah.
Uh,
We haven't spoken yet about your biosecurity plan that you're putting forward, and sort of to make that transition. I might just make a few comments to show. Our view, as we've been doing the analysis. I talked about that taxonomy of stop, identify, isolate, treat, and learn. There's another one. There's another one, which is what is the threat? If there's so much fighting against the air, and to bring back any sort of solidarity, any sort of congruence, any sort of progress. We need to have a clear understanding about what we're fighting, and our view is that the primary view that we're fighting is an information war that's on a biological carrier. And so if we're fighting an information war, credible information, verification, like how do you actually know what you're hearing is true? And then how do you have independent sources to validate that what you've heard is true? Can you speak to this idea of this biosecurity plan in the face of corruption, in the face of opportunist voices that are coming in to this information war?
Exactly. That's a good question. I think, we're trying to do something for the tourism industry, for example, of Ecuador. The tourism industry of Ecuador is a great tourism industry. We have destinations like the Pacific Coast, the Andes, the Amazon, and the Galapagos Islands. And we have great tour operators and great hotel chains. And we need a lot of work still, as a developing or emergent international destination. But what we need to do now is the first thing is to create trust between the suppliers, us, and the markets, be it the national market or be it the international market. And so the first thing we need to do is to try to make sure that people can be offered a health and health and wellness during their experience, right? And for example, we need to, this biosecurity plan includes working on protocols for restaurants, hotels, etc. It also with the certification, and we're trying to see also to see if we have some kind of a biosecurity, but you can't say biosecurity, but it's a health and wellness certification for being able to have these processes of supervision and management of biological risks. So this is the important thing that we need to do as much as we can, and to control and supervise all the sectors that have been certified. And so once we do that, we have something that can help the experience of tourists and also attract the market, which is important because the resources, the natural and cultural resources we have are extremely beautiful.
Patricio, I frequently use the wrong words, and in most of those cases, Nathaniel virtually slaps me. And I did the same before we started, and I said that your certification was a corona-free certification for cities, and you virtually slapped me. And so correct me, and please tell our viewers what I did wrong.
You're my good friend. I could never do that. But anyway, I was just referring to that some countries are working on a COVID-free biosecurity tourism plan or biosafety tourism plan, and that doesn't work because it can't be COVID-free, because you could have tourists that come in, they could pass, even if you have a biological passport, like maybe at the airlines, they stop you, they take your temperature, etc. And then you're coming into the country, you could be asymptomatic. And once you're asymptomatic and you go through the tour operators, the transport, the hotels and everything, but your disease or your infection matures and you go back to your country, and for sure you'll think that you got it in that country. So all of a sudden you'll have lawsuits all over the place for everybody. So you can't say COVID-free at all. You can say, that you're managing as best as you can biological risk. And this is what we need to say.
And you are working in this certification program with some of the top experts in the world, is that correct?
Yes, I'm working with Dr. Peter Tarlow, which is one of the top US government advisors in tourism security and world renowned expert, who has worked in security programs in Disney and Hoover Dam, Statue of Liberty, World Cups, soccer World Cups, Olympics, etc. He's one of the top guys who has relations with friends that are in the COVID science right now, supporting most of the information for the COVID scientists and COVID task force in the United States. So a labeling of a certification program with validation from a COVID scientist, I think is one of it's the way to go.
Patricio, both what you are doing with Eco Bahia Foundation, what you are doing now with Dr. Tarlow for this certification for cities,
We're proposing, excuse me to interrupt you, but we're proposing this to the Ecuadorian government, and they're listening to us, and I think in a little while they'll decide on this program.
Awesome. We need to wrap up before, so in 1 second everyone will share their thoughts. Before we get there, Patricio, one question for you. There are about 200 presidents in the world, presidents of countries. If I want to teach one of them how to surf, how do I do that? Because you did it, so what do I need to do? First, I need to learn surf, I guess.
No, surfing is fantastic. All you need to do is have a surfboard, match the wave speed, paddle towards the beach, watch your back, and go down that wave. It's beautiful. Best experience I've had is going down a beautiful crystalline blue wave, getting inside the tube, and right next to the tube, watching these sea lions surf on the wall of the wave with me in the Galapagos Islands.
Wow, that's that's one big reason for staying alive as long as we can.
I think so. I think so, my friends.
Will has for his whole life surfed market waves, and I for my whole life have surfed technology waves. I think I'd trade both of those for surfing a wave in the Galapagos with a turtle.
I've trained presidents, so you can come here and it'll be easy with you guys. You guys look like
only after we'll have to manage the bio risk, and we'll get right on that first.
Patricio, your 30-second closing comment.
To everybody, we all depend on a healthy population. We all depend on hope. We all depend on resilience. We all depend on each other. And it was great for me to see the other day when I came out of quarantine to go to see. I had to go do some shopping, very well protected, and see everybody else super well protected, super disciplined here in Guayaquil. And the only thing I couldn't see was smiles behind the mask. I couldn't believe I was in a world with everybody with masks, and we're defending against an invisible enemy. But then I couldn't see these smiles, but then all of a sudden I would see the smiles in the eyes. And I think that's what gives us most hope. And I think we feel good with each other and together. And so that's one of the things that I think will be great for humanity. That's the most important thing is, to love one another and to be able to have faith in yourself and to have faith. I say faith in the universal architect that gives us all this energy of love.
I received a joke on my phone the other day, and the joke was, I cannot believe that I just walked into a bank with a mask on my face and I asked for money. Nathaniel, your closing.
No, I'm just thank you so much, Patricio. To our viewers, I'll just say, if you like what you saw with what Patricio is doing, be sure to look up his foundation below. Please contribute if you have the means. And then also, if you like what we're doing with the Cured at Home, we're looking for more people that we should interview. We're looking for software developers. We're looking for medical professionals to help build the trust that Patricio spoke of, that's so critical and so trusted. You'll notice that we don't have a lot of information on our website right now because we're vetting what we put out there first. So what I will say is while the world is in so much turmoil, you hear us talking about the problems. Don't reopen the economy, flatten the curve. Oh, you're going to put your loved ones at risk. I'll say only talk about those problems if you're also talking about a solution. Otherwise, stick with what Patricio said. Look for the love in the eyes.
In my case, for the viewers who think that this content makes sense, please subscribe to the YouTube channel. You can have also you can use the bell to be notified of upcoming videos. Please share. Ideally, please join our newsletter at our website. And so yesterday, what you guys were saying just seconds ago, yesterday we posted an article about should we continue the lockdown or should we open the economy? And it's this dichotomy of, do I die of hunger or do I die of coronavirus, right? So if I cannot if I run out of money, if I cannot work, and if I cannot get a salary and I cannot feed my family, I have to see my child die of hunger. And if I go to work, then we all die, or we all go to work, then we all die of coronavirus. And that seems to be the only two options. Do I die of hunger or do I die of coronavirus? And we propose that there is a third alternative, and that third alternative is everything that Nathaniel was mentioning earlier about those 5 steps. We are still working on that piece of content. There's 2 things that are super clear that can be done. One is if everyone wears a mask, if I am infected and I wear a mask, I'm not passing the coronavirus to anyone else. So perhaps instead of locking the whole world down, if we are conscious and we wear masks and if we get the tests, and then like Patricio did, when I think that I'm infected, then I self-isolate so I don't pass the virus to other people. And then if I can be cured at home, which is what we are proposing, that's part of the solution. And so we can, and at the same time, we reduce significantly the number of patients who need to go to the hospitals, because only the severe cases go to the hospitals, and that's only 7% of the total. Again, if you like what we are doing, please join us and help spread the word. Thank you very much, Patricio. We are I'm super happy, and I know that now that our viewers are getting to know you, that they too are super happy that you are alive and you have many more years of surf and of teaching presidents how to surf. Nathaniel, it's a pleasure as always. And for our viewers, thank you very much. We'll meet you the next time.